welcome back to Open. You know, the holidays are among us, mi gente. Pero, we'll say, while it is joyous, right? It's a joyous time of the year. It's also important to check on friends and loved ones who may be struggling with their mental health, especially during this particular climate, right? And so today we're going to welcome the Rainbow Clubhouse, the part of the Emma L. Bowen Community Center, which offers work-ordered rehabilitation programs for adults with mental health diagnosis. And their mission is to provide individuals with the opportunity to find meaningful employment, healthy relationships, and community. And here to share more, we welcome the Emma L. Bowen Community Center's Deputy Executive Director, Lawrence Fowler, and Rainbow Clubhouse Program Director, Lilibeth Marchena, and Rainbow Clubhouse alumni and staff member, Diana Dinney. Hello and welcome.
Thank you.
Thank you so much for having us.
Yeah, I think this is an appropriate time for us to be having these conversations, wouldn't you say?
Without question. And with that said, there's never an inappropriate time to have it, but particularly now, because the holidays are when people struggle, and the holidays are when people need support. And the holidays are also a time when we need to eliminate the stigma of asking for that help. Right. And so this, yes, I think on all sides, it is a time now.
Well, you know, thank you for saying that. And yes, you're right, at all times, but it just amplifies, right? For whatever reason, it's amplified during this particular time of the year. Can you just share with us a little background on the Emma L. Bowen Foundation, right? And the whole premise in which the actual institute formed itself?
So we began as a storefront in 1969, created by what I guess back in the day you call community activists. And what happened, we're in a very dense medical service arena. We had Harlem Hospital, New York Presbyterian, St. Luke's, whatever. There was not one mental health service program in the entire area. So the community got together, said we need to do this. And we emerged from the notion that we're going to deal with the problems of living. And if you fast forward 30 years or so, that's what people refer to as the social determinants of health. But we recognized that people were struggling with various concerns, and that they were and how they were interrelated, and how they needed to be addressed, and how we needed to help people from a strength-based, person-centered perspective. And we have maintained that from our founding. And in 1986, we were incorporated as the Upper Manhattan Mental Health Center, Inc., and subsequently now the ML Bowen Community Service Center, AKA Upper Manhattan. And we look to cover the gamut of our community. That means from 2.5 years old to 90 plus years young. We provide mental health services, addiction treatment services. Our addiction treatment services have started now at 12 years of age, because the other part of what we do, we meet the needs that people present. And that is, for us, very critical in the community. And I know when we were speaking off camera about mindfulness, we are mindful for what needs to be addressed in our community, which is mental health support, which includes adults, includes children, includes also a recognition of what has happened post-pandemic, and how it has so heavily impacted our community. And back to your question, and particularly being felt at times like now.
Right. And so perhaps you can elaborate further on the Rainbow Clubhouse so that we have a better understanding if the Rainbow Clubhouse is like a sector within the Emma L. Bowen, and how does that serve in the items, because he listed a lot, which is wonderful. It's wonderful, and it's wonderful the way you did it too, because you can tell it's a space of welcoming.
Yes.
Absolutely.
Yes. So the Rainbow Clubhouse, we're actually accredited through Clubhouse International. And what that means is that we're focused on the work ordering. The Rainbow Clubhouse as well is a psychosocial rehabilitation center. So, you know, our main focus, as Mr. Fowler had mentioned, we're a strong based, person-centered.
And strength-based.
Right. But although you have clinicians there, because I understand you have psychiatrists, you have psychologists, you have therapists, right?
But that's actually separate, because the Rainbow Clubhouse is a freestanding.
Right, that's where I want to
Okay,
understand.
all right.
We have a lot of different departments.
So pardon me, because I didn't do that entirely justice. We're the auspice agency for the Rainbow Clubhouse. What we do, we provide outpatient mental health services, care management services. We also have a food pantry. And what we do, we deal with treating the person with regard to the diagnoses that are presented.
Got it.
The Clubhouse is a psych rehab support program. It is not about your diagnosis. It is about you and how to support you in your goals with regard to connecting with the community. So there is no clinical work that goes on in the Clubhouse. It is intended completely to support the individual who, yes, I have a diagnosis, but I am not that diagnosis. I am here to be better, to be well, and we are to work together, because part of the Clubhouse is that we work side by side. There's staff and members together working so that we all are better.
Understood. So on that note, as the program director,
Yes.
I guess you can describe the kind of programs that you offer,
Absolutely,
right?
yes.
With regards to this acknowledgement of trying to transform.
Yes. How I had previously mentioned, we're accredited through Clubhouse International, and what that means is that we focus on work order day, which the members learn how to build work skills. So, for example, we have different units. We have a culinary unit, we have a media unit. So through these units,
You have a media unit, a culinary
unit, we have an
you
administrative
develop them in
unit.
cooking and
Yes.
media arts,
Yes.
right? Or
Yes. We have like
Technology.
podcasts, newsletters. We also do workshops. Besides that, our workshops are also centered on, we have like co-occurring, smoking cessation. We also focus on mindfulness. We do
Mm-hmm.
yoga, meditation. What else? We're a family.
Well, yeah, it sounds like you're a community,
Yeah.
and it sounds like people are part of it on different levels.
Mm-hmm,
And so, what if somebody is diagnosed with a severe mental disorder,
There's no discrimination. And when you're a member for life.
right? And so,
Mm-hmm.
you actually, the program consists of everybody blended together?
Yes, absolutely.
Fascinating.
And if you walk into our program, our place, you can't even tell who's staff and who's not.
Ah.
We all blend in together. There's no hierarchy. We're
Yeah,
all,
it's community.
and it's member driven.
It's member driven.
That's the beautiful part.
That's a wonderful segue into Diana.
Yes.
Diana Dini. Denny?
Yes,
Dini?
Denny.
Dini. I said it right the first time. Your story is really inspiring. Now you're an alum, but now you're a staff member. And if you don't mind sharing some of your hardship with our audience, I think it would loan itself to just providing some sense of hope if anybody's lost at this particular time.
Well, I come a long way to get where I'm at today. I started from a young age where I couldn't understand what was going on, but I was there. And I met a couple of people it was called Rainbow Club then too, but it was a psychosocial. And they brought me into the rooms of the psychosocial where there was people that understood me, that I could be around, that didn't judge me, that was going through basically some of what I was going through and more.
So if you don't mind, I'm going to share a little bit of your background
Yes.
with regards to gambling, recreational drugs,
Yes.
incarceration,
Yes.
and then finding the Rainbow Club House where they nurtured your needs, and now you serve in paying it forward as a staff member.
Yes.
And peer specialist.
And I'm a peer specialist.
You're a peer specialist.
She's a peer
Which
specialist.
it's important for them, right, to be able to have somebody relatable.
Yes, because I've been a lot of places and I have done a lot of things in my life. And I just learned from them, and I was given the opportunity to reach out to people that had a helping hand for me. And not only did they open up the doors for me personally, they opened doors for me financially and opened up my mind to understand what was going on with me.
And so when you say open up doors for you financially, what does that entail, right? Because this is a development program that we're talking about.
I believe that I was going to be on Social Security for the rest of my life.
Right.
because I was disabled.
Uh-huh.
I was diagnosed, I was disabled, mentally and physically. But when I got to the Rainbow Club, they let me know that that's just my diagnosis. You know, I can work through that. I can find something that I can do and it can help others that will understand that, you know, this is just a diagnosis we have, but this is not us.
Correct.
This is just something we have. So they let me understood that and let me found a way that I can help others while helping myself.
That's beautiful. That's beautiful. And I think a lot of people can afford to listen and hear that and really take it in deeply right now in this particular time, because I'm sure there's a lot of people walking around undiagnosed,
Yes.
right? Because
Without
they don't
doubt.
want to know,
Right.
right? Because they don't want to be identified as such, when in fact it's not who you are.
Right.
It's just a means of knowing how to navigate.
Right. Or they're not aware. Or they're brought up with those old school values that they don't want to see a psychiatrist, a psychologist, or a therapist, or a counselor, etc. You know, it's a lot of stigma behind that too.
So, in closing, can you share how one can become a member of the ML Bowen or the Rainbow Clubhouse? Like, how does that work?
So to become excuse me, to become a member of the Rainbow Club, we strongly suggest to please come down to the clubhouse. We're at 1727 Amsterdam Ave, right in Harlem, in Manhattan, 145th Street. We encourage for you to come in, and we daily we give tours, especially to potential new members, because it's kind of hard to explain it. It's best to show you how each process is with the clubhouse. So we strongly recommend that. Besides that, you know, you would have to have a mental health diagnosis. We do have referral forms that are available that we can send to, and you actually have to be actively seeing a therapist, a counselor, etc.
All right.
Yeah.
All right. Well, thank you for
And
that.
to do that, we www.bowencsc.org is our website, and you can reach us through info@bowencsc. You can also call us at 212-694-9200. We are open there. We are a judgment-free environment. So this is not about, this is there, so there should be no shame because there is no judgment.
Yes.
What we're here to do is to help and partner, because we are all better when we're working together.
I love that. I love that you use the word help and partner, because it does make a world of a difference.
I'm so sorry, Rhina. I just have to mention real quick. So the clubhouse is actually open Monday through Saturday, 9 to 5, and we're open on holidays. We celebrate holidays together.
Oh, nice.
Because you know you have members that
Right.
don't have
And
family,
to
or
your,
their
and to
family
your
is far.
original question,
Right.
because this is that kind of time.
Yes.
Well, look at that. We came full circle. Thank you so much, Lawrence Fowler, Lilibeth Machena, and Diana Denny. Thank you so much for sharing your story. And once again, we were speaking about the Rainbow Clubhouse at the ML Bowen Community Center, and all the services that they offer. So if you're interested in more information, you can visit bowencsc.org. All right, stay tuned. There's more open after the break.